The National Association of Sea Dogs, NAS, also known as Pirate Confraternity, has extended vital healthcare services to Kukwaba village in Buhari Area Council of the Federal Capital Territory, where residents have long struggled without access to basic medical care. Over the weekend, NAS conducted a free medical outreach in the undeserved community, offering consultations, blood pressure and glucose checks, laboratory tests, and treatment to more than 200 residents. The outreach was organized by the Association Zumas and Sahara Deck. Organizers described the initiative as not only timely but urgent, given the absence of government-owned health facility in Kukwaba. The nearest hospital is said located approximately 18 kilometers away, making emergency care nearly inaccessible. The outreach coincided with two major milestones for the group: the 91st birthday of Nobel laureate and founding NAS member Professor Wole Soyinka, and the 40th anniversary of medical service by Dr. Joseph Oteri, current NAS Capone and lifelong advocate for accessible healthcare. Dr. Otari, who has practiced medicine since 1985, said the initiative is part of NAS's decades-long commitment to undeserved communities. He recalled the organizers' first medical outreach in Rivers State nearly 30 years ago, affirmed their continued mission to deliver sustainable health through targeted interventions.
NAS on its own have been doing a lot of medical outreaches. In 1996, I did an outreach in Rivers State, right, while I was still in Port Harcourt. And after that, we'll be doing outreaches at every quarter when we go for our quarterly meetings. So this is just to show that since you were in charge of all those outreaches, let us celebrate you with an outreach. So this is what we've done. I didn't know when they were planning it.
Who are your targets?
Community. Most times, what we do, we support the downtrodden, right? People that couldn't afford some things are the ones we actually target. So if you look at most of these people here, some of them might not even have access to paracetamol if they go to a clinic. So we felt, okay, let us bring all the things they need. Normally, they start with the scoping mission where they find out what are the prevalent ailments in the community. Then they procure drugs to take care of those ailments. So they have a lot of human resources, doctors, nurses and volunteers plus laboratory people. So that's why they're all here doing this work too.
Medical officer of Zumadec, Dr. Victor Chukwuemeka, described the dire healthcare conditions in Kukwaba and urged the government to act swiftly. According to NAS, future outreach plan will expand to include maternal health services, eye care, chronic disease management. The association is also in talks with Federal Ministry of Health to advocate for the establishment of fully functional primary health care center within 2 kilometers of Kukwaba.
Just the start. We're going to come back here on a later date based off what we've seen today. Because this is just asking them to come for the basic checks, the basic medications, treating malaria, the sepsis, the basic things you see in an outpatient clinic. That's what we're doing here today. Off of what we're doing today, we'll go from there. Follow-ups on the other specialties, we'll invite them to come. About capacity, this is NAS. What we're doing here is, our central body is aware we're doing it. We have the capacity to even go beyond the numbers, if need be. Yes. For a start, we're attending to the basics. Free medical checks that would help us indicate whether you're hypertensive, diabetic, the C-class that don't even know their status. They're always in the hospital. We have 2 cases that we've identified this morning that are C-class. They're always in their local hospitals. They give them markings and all that without knowing that these guys are actually C-class. We're also offering our lab interventions that will help us detect all these things. The basic investigations, the lab, the full blood count, what do you call it, the panels, hepatitis panel, HIV panel, all of those, so that you know where you are, so that we can go from there. Then we've also done a scoping on the follow-up to come back in this community for the ophthalmology intervention.
Obrina Ndoize, area mate with the Area 9 Command, emphasized the group's broader mission of service and community upliftment.
So we organized this outreach to honor both of them. We think that as a social advocacy organization, the best way to honor them is to come to the less privileged, the underserved, to make sure that we also offer some help to them. So essentially, we decided to come to Kukwaba village in Kubwa here to do this medical outreach.
Local residents expressed deep gratitude, sharing painful accounts of loved ones lost to preventable conditions like hypertension and complications during childbirth due to the absence of nearby medical facilities.
1 year plus now. If I'm sick, I do go to like all those big pharmacies from DBA. If the sickness is much, I'll go to all this private hospital. So the general hospital is far from this place, very, very far. That is it. Some of them that they don't have a private, that they cannot go to private, they don't even have money. Sometimes they do go to pharmacy and just get, you can see that what they are sick for, they're supposed to spend like maybe 40,000, 50,000. Due to say they don't have money, there's no primary health care here, they will just go and afford something of like maybe 5,000, 3,000 to just take good care of themselves.
The National Association of Sea Dogs reaffirmed its dedication to long-term advocacy and grassroots medical intervention, pledging continued support for communities most in need.